I am here to say thank you so very much because the reality is that we can have state monies put into this, we can have a state organization, but it does not happen without you. All things that happen in Georgia that make a difference happen at the local level. So I'm here to welcome you if you haven't been a Board of Health member before, and also to say thank you very, very much. Because you know that you heard me say, perhaps if you were at the luncheon, that obesity is a #1 health initiative for Governor Deal. It certainly is a #1 health initiative for the Department of Public Health, but we don't know how to reach the school board locally or what you need locally. You may be doing great. You may have walking trails, you may have bike trails, you may have a school superintendent that says, you know something, we are absolutely going to do that 30 minutes of physical activity, or you may not. Which means that at your level, I can go to your school superintendent and I can say, please do this. I can say it's going to be good for your children, and by the way, here's some studies that show that it'll increase their standardized test scores, and we know you want to do that. But you're the one that can make the message happen. It's interesting, as part of the SHAPE work, when we first went to the State Board of Education, and we said, you know, this is really important work. They said, that looks like a lot of work to be done. But what we'll do is we'll give you the 15% lowest academically performing school systems, and you can take this physical activity into those school systems and start there. We said, okay, thank you very much. And then we got the SHAPE data back. There are 2,000 schools in Georgia. In the bottom 100, as far as physical fitness was concerned, about 3/4 of their at-risk schools were right there. There's an association. I mean, if you look at the national data, some of the most interesting data was done doing comparing school systems. They did a 3-year pilot where they had one group of schools that had physical activity of increased 30 minutes, and then they compared it to another school group that did not. And there was a dramatic increase in math scores especially, but there was an increase in math, reading, and English language skills. We will be happy, we've done a presentation, we will be happy to give you the PowerPoints on that so you can talk to your local community, and we hope that you will be part of this huge effort to really change healthcare in Georgia. Because there's no question, I mean, I'm not willing to be, I'm not willing to just say thank goodness for Mississippi anymore. I think that Georgia needs to lead the nation in changes that make our population healthier. And I am certain with your help we'll be able to do that.